Good morning, everybody. Welcome to our next edition of Pravachana Malika. This is talk number 9 for September. And our talk today is on Indian traditions, the positive habits in kidney disease. This is a very short title of a very interesting set of topics that today our keynote speaker, Dr. Smrita Dorairajan, will be giving. She's a associate professor of clinical medicine at University of Missouri. So I'm very happy to invite all of you to this exciting program. And we will start with Veda Kusumanjali. Vasan sir, can you please go ahead?
So, Bharat, you please start. He's there. Yeah, Vasan is there. Good.
Om Bhadrane Vyatra Dirairangaye Tushtvagum Sastanovihe Veshema Deva Hitan Yadayuho Tastina Indro Vrdashrabha Tastina Pusha Vishwaveda Tastina Starksho Arishtanemihe Tastino Brahaspatir Dadhato Om Shanti 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 Om Agne Naya Supataraye Asman Vishwani Deva Vairani Vidwan Yodhyasma Juhuranhameno Uishtam Te Namamuktim Vidhema Om Shanti 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 Om Brahman Brahmano Brahmavachasi Jayatam Arashtre Rajanyah Sura Ishabhyati Maharatho Jayatam Dogdri Dhenuho Odhanadvan Asusaptihi Purandhir Yosha Jishnarateshta Yo Yuga Asya Ejamanasya Viro Jayatam Nikame Nikame Nahapajanyo Navarshato Alavatyo Navoshadayah Pachyantam Yogakshemo Nahakalpetam Om Shanti 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 Om Apyayantu Mamangani Vakpranaschakshuho Shotramato Balamindriyani Sarvani Sarvam Brahmopanishadam Maham Brahma Nirakuryam Mama Brahma Nirakarotu Anirakaranamastu Anirakaranam me Tadatmani Nirate Sudharma Om Shanti 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 Om Swastino Mimita Mashvina Bhagaswasti Devaditira Narvanaha Swasti Pusha Asuro Dadhatunah Swasti Dyava Pruthivi Suchetuna Swastaye Vayumupa Bravamahe Somam Swasti Bhuvanasya Yaspatihi Brahaspatim Sarvaganam Swastaye Swastaya Adityaso Bhavantunah Vishve Devano Adya Swastaye Vaishvanaro Vasuragni Swastaye Deva Avan Vrubhavaha Swastaye Swastino Rudra Patvam Hasaha Swasti Mitra Varuna Swasti Patye Revati Swastina Indraschagnischa Swastino Adite Krudhi Swasti Pantha Manucharema Surya Chandramasa Viva Punardadatha Tadna Janata Sangame Mahi Swastyayanam Tarkshyam Arishtanemhim Mahadbhutam Vayasam Devatanam Asuragnamindra Samatso Bruhadyasho Nava Amivarohema अम्होमुचा माङ्गिरसं गयं च स्वस्त्यात्रेयं मनसा च तार्क्ष्यं प्रयतपाणिः शरणं प्रपद्ये स्वस्ति संभादेष्वभयं नो अस्तु। ओम शांति शांति शांति। हरि ओम तत्सत।
Thank you, Vasan sir. So now we will have the Sangeetanjali by Laya Anand. So Laya, could you please start?
ஐந்து கரத்தனே ஆனை முகத்தனே இந்தின் இளம்பிரை போலும் ஏற்றனே நந்தி மகந்தனை யான கொழுந்தினை புந்தியல் வைத்து அடி போற்றுகின்றேனே கலை நீரை கணபதி சரணம் சரணம் கஜமுக குணபதி சரணம் சரணம் கலை நிறை கணபதி சரணம் சரணம் கஜமுக குணபதி சரணம் சரணம் தலைவனின் இணையடி சரணம் சரணம் சரவண பவகுஹ சரணம் சரணம் தலைவனின் இணையடி சரணம் சரணம் சரவண பவகுஹ சரணம் சரணம் கலை நிறை கணபதி சரணம் சரணம் கஜமுக குணபதி சரணம் சரணம் சிலைமலை உடையவா சரணம் சரணம் சிவ 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 சரணம் சரணம் சிலைமலை உடையவா சரணம் சரணம் சிவ 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 சரணம் சரணம் உலை வரும் ஒரு பறை சரணம் சரணம் உமை சிவை அம்பிகை சரணம் சரணம் உலை வரும் ஒரு பறை சரணம் சரணம் உமை சிவை அம்பிகை சரணம் சரணம் கலை நிறை கணபதி சரணம் சரணம் கஜமுக குணபதி சரணம் சரணம் கலை நிறை கணபதி சரணம் 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 சரணம்.
Excellent, Laya. Thank you so much. Very nice. So next we will introduce the speaker. So I'm thrilled to introduce Smrita briefly. He is a nephrologist, and I think this is a great program where we're getting perspective from the medicine field, from our ancient times to modern times, to improve our lives. And we've had Anand, her husband, give us exciting talks in the past from cardiology perspective. So I'm excited to introduce Smrita. Nana, do you want to give a small introduction before Smrita starts?
Yes. So welcome to Smrita Dorairajan and also Dr. Karthik, also Dr. Gopi Chand. Today we have all doctors joining to speak about the positive habits and the management of the limbs inside and outside, so that the human body will have a very sound body then sound body, sound mind, and sound happiness, and all that. So Smrita Dorairajan, I did not know. I only know her as she was coming, uncle, good morning, good evening, good night. But when I saw her biodata, I was just really stunned. It runs to a number of pages, but she has got great, not only that associate professorship, etc., but she has got wonderful training, academic achievements, many awards, and many publications along with her father also, Dorairajan, who is a radiologist in Madras with high experience. Now he's emeritus professor, and he has got wonderful distinction in the community service of the medicine, and reached a lot of research experience. And she has got also as an investigator, co-investigator of the multi-center drug trials in nephrology. Apart from all that medical excellences and achievement, Maharatha, Tiratha, she's a dancer. She's a Kalamayi, Kala Poshaki and Kala Dhyapaki also. So in Bharatanatyam, she has a number of students. Even today, I don't know how she makes time in spite of her busy medical and patient. But she is making a lot of time and training young students and all that, and encouraging them to have the Arangetram also in dance, so that this art and science both are clubbed in this in Smrita's personality. I'm very happy about her, and we expect a lot of positive habits, Indian traditional habits, which will definitely help for our health management, human welfare, etc. So she will be talking more about that. And incidentally, we have two more students of our Kendra, Dr. Karthik, who is running a nursing home in Double Garden, Wilson Garden, with number of beds purely specialized for diabetology, kidney diseases, kidney problems. His father also is also he's also a great kidney specialist and diabetologist. And next we have got also the Dr. Gopi Chand. He's internist. He's MD in Victor, who studied in the medical college Bangalore and worked in the army, and now retired. And now he has come. He has also become a sincere senior student of our Kendra, learning Veda. And well, everybody is very good in the subject. And so I think, and moreover, I should tell about Gopi Chand. He in a doctor's conference for the first time when he was a member, he introduced Veda prayer, Veda Kusumandali, and then all people. He himself was also one of the reciter. So these great people are now have joined, and I welcome all of them. Please, I give to Smrita to speak of positive habits and all that. Thank you.
Thanks, Uncle, for that very kind introduction. And it gives me great pleasure to be talking today on this forum. A very good morning to everybody in the US, and a good evening to people in India. So we'll move on to the talk. Today I'm going to focus on kidney health and some of the ancient practices that we have been doing in India that has a positive effect on kidney health. So why should we focus on kidney health? So chronic kidney disease, wherein your kidney function is reduced, is becoming a huge problem and affects more than 20 million Americans, and over 500,000 have end-stage renal disease. The most common causes of chronic kidney disease are diabetes and high blood pressure. And it is an independent risk factor for heart problems, cognitive dysfunction, hospitalization, and also for all-cause mortality. So it is very important that we focus on kidney problem. So what are some of the risky behaviors for acquiring kidney disease? Consuming too salty or spicy foods, not drinking enough water, consuming a lot of fermented or processed foods, being obese, cigarette smoking, chemical exposure, stress, and not getting enough sleep. So if you see that a lot of these things we are not paying attention to because we have a very stressful life and we are running around and not taking proper care of ourselves, eating a lot of processed or prepackaged food, and we are compromising on our sleep to get our daily work done. So we have to focus a lot on these things. And coming to chronic kidney disease in India, there are several more issues that contribute to high prevalence of chronic kidney disease in India. This starts right from birth, where the UN Children's Emergency Fund data shows that 28% of children that are born are less than 2.5 kilograms at birth. And this is because of malnutrition in the mother. Hypovitaminosis A and other nutritional issues during pregnancy may cause smaller kidney volume at birth and a lower renal function. Also, marriages among relatives and genetic inbreeding increases the risk of congenital anomalies of the kidney and urinary tract, and it can lead to obstruction and other urinary tract problems like reflux. Also, poverty, poor sanitation, pollutants, water contamination, overcrowding, and known and unknown nephrotoxins like heavy metals and some plant toxins that are found in indigenous remedies may lead to glomerular and interstitial kidney disease. Added to this is the growing burden of hypertension and diabetes mellitus. By 2030, India is expected to have the world's largest population of patients with diabetes. Because of the challenges in access to care, over 50% of patients with advanced CKD are first seen when the eGFR or the kidney function is almost less than 15%. So this sobering number highlights the need for a robust screening program for those at risk for CKD. The reported prevalence of CKD in different regions in India ranges from less than 1% to 13%. And recent data from the International Society of Nephrology's Kidney Disease Data Center reported a prevalence of 17%. Compounding these issues are the fact that there are 1.3 billion people, but there is a shortage of nephrologists, only 1,850 nephrologists. And even these nephrologists are distributed mostly in the urban centers, leaving rural India without much care in nephrology. The nephrology training positions are inadequate to grow the workforce, and the situation is worsened by brain drain to developed countries. I shouldn't be talking about this because I myself am sitting in the US. So over 90% of patients requiring dialysis or some form of renal replacement in India die because of inability to afford care. And even in those who start on dialysis, 60% stop for financial reasons. And among patients undergoing kidney transplantation, there is a lack of, or there is organ shortage, and there are unexpected complications leading to potential serious financial hardships. So it is all the more important that this kidney problem should be caught in the very early stages so that we can prevent progression to dialysis and needing renal replacement therapy. So now we're going to talk about the key players: hypertension, diabetes. So hypertension, the global prevalence is really high. And among adults in the US, treatment of hypertension is the most common reason for office visits to the doctor and also for the use of chronic prescription medications. In addition, roughly 1/2 of hypertension individuals do not have adequate blood pressure control. So high blood pressure is when your blood pressure is over 140 millimeters of mercury systolic and over 90 millimeters of mercury diastolic. So salt is a key player. So to protect the kidneys, we have to limit our salt intake. And salt is one of the senses that can easily be trained. So if you get accustomed to low salt in your diet, then you find that the body adapts very easily and you don't require the high portions of salt anymore. So 9 out of 10 Americans consume too much sodium, which is salt. So the recommended is anywhere between 1,500 milligrams to about 2,500 milligrams per day. But if you see the average American is taking 3,400 milligrams of salt, and sometimes when they are on processed or canned food, even as high as 6,000 to 7,000 milligrams of salt are being consumed. So whenever I talk to my patients about salt, they tell me, oh, doctor, I don't add any salt to the food. But what they don't understand is the salt is already there in everything that comes from the store-bought food. So 65% of the salt intake comes from food bought in retail stores. 25% comes from food from restaurants, and only 10% comes from home cooking and at the table. So it doesn't make any sense when you say that I don't add any salt when everything is like pre-packaged into your meals. So we really have to get into the habit of looking at food labels and seeing the amount of salt in food that we consume and going for lower sodium options. In India, this is less prevalent because we are used to cooking our own meals, and so we can control the amount of salt that we add. But in US, this is a huge problem where less than 10% of people prepare their food from scratch, and 90% of people rely on store-bought food, which they just heat up or put in the oven or microwave. So we have to really address this issue. So our children are not spared either. If you go to the sodium intake in children, it starts very early, even 6 to 10 years of age. The salt intake is nearly 3 grams, and it only gets worse as they get older, with teenagers having the maximum impact and consuming nearly 3.6 grams of sodium a day. So if you go to the food which are like very high, these are like the salty 6. So breads and rolls, we don't think have salt in them, but it's very unfortunate that most of the breads and rolls that we eat have a lot of sodium in them. And of course, all the processed meats and cured cut meats like pepperoni and sliced meat, all of them come with very high load of sodium. Pizza, which is like the universal favorite among children, and also now a lot of adults are taking in this sort of pizza. This has like loaded with cheese and salt. So other thing is chicken. Most of the poultry, they are like injected with like salt solution as a preservative. Soups, which we consider as like very healthy, even they are not spared. So they can have like anywhere to about 1 1 gram of sodium in them. And also the sandwiches that you buy, the burgers and sandwiches, these can give you nearly 100% of your daily suggested load of sodium. So we think that only Chinese food has a lot of soya sauce in it. And that is the problem. And China is the only one having high salt intake. But if you see, India is not far behind and has nearly 9 grams of sodium. And United States is also about 9 grams. So we are also high up there in our salty eating habit, which we need to really quit. And if you see salt intake across India, so the southern part of India, all in green, so nearly 8.1 to 9.7 grams of sodium. And Karnataka, for some reason, I don't know if it's because of pickle intake or what, it's even higher, about 9.7 to 11.3 grams of sodium. And some places in the northeast, like Tripura, have nearly 13 grams of salt intake. So what are the effects of eating too much sodium? When your kidneys are not healthy, the extra sodium and fluid build up in your body, and this can cause swollen ankles, puffiness, a rise in blood pressure, sometimes lead to shortness of breath, and even fluid around your heart and lungs. And how much salt should you eat as a part of a healthy diet? As I said, it should be no more than 2.3 grams of sodium per day. So how can we reduce the salt in your diet? So there are many herbs and spices that you can use to add flavor to your food instead of salt. And I'm going to go over them now. So all kinds of salt. So they ask about salt substitutes, the patients. So all kinds of salt are bad, whether it is a garlic salt, onion salt, celery salt, any kind of salt. And even the so-called light salt is not that good for you. And even the meat tenderizers are not good for you. So any kind of salt should be limited or restricted. But you can resort to spices like fresh garlic, fresh onion, garlic powder, onion powder, black pepper, lemon juice, and some seasoning blends or vinegar. All this can be used to add flavor and to compensate for the salt. So Indians, we are very good at this because we use a lot of garlic, onion, and also pepper, cumin, and other kinds of seasoning, which may help us to cut back on our salt intake. So to manage hypertension, we have to eat a healthy, balanced diet. We have to exercise at least for half an hour, at least on 3 days or 4 days of the week. And being in the ideal body weight is very helpful on the kidneys because it reduces the extra stress needed to filter more toxins. So that is helpful. Limiting salt and coffee intake, any form of caffeine that's found in energy drinks and in coffee, that helps to control your blood pressure. Quitting smoking and reducing alcohol consumption. So this is how a healthy eating plate should look. It should have plenty of vegetables and fruits. These two should make up nearly half of your eating plate. The other small portion should be for whole grains and healthy protein, which is like vegetable protein or lean meats, like fish and poultry, or nuts and legumes should be consumed. So we, in the Indian diet, we can substitute with dal as healthy protein. So going on to diabetes and the kidneys. Diabetes is the leading cause of kidney disease. About 1 out of 3 adults with diabetes end up with kidney disease. So it is so important that we address this key player. So how does diabetes affect the kidneys? So when you have diabetes, it causes microvascular or small vessel changes throughout the body. So it also causes changes in the vasculature or the filtering unit of the kidney, which is called the glomerulus. And this leads to scarring. And so this filtering unit doesn't function properly, leading to kidney damage. Are some people more likely to get diabetic kidney disease? Yes. So people with high blood pressure, poor blood sugar control, some with inherited tendency, and who are consuming a sugary and poor diet are all at high risk for developing diabetic kidney disease. How long does it take for the kidneys to become affected? Almost all patients with type 1 diabetes develop some evidence of functional change in the kidneys within 2 to 5 years of diagnosis. And about 30 to 40% progress to more serious kidney disease, usually within about 10 to 30 years. On type 2 diabetes, it's less well-defined, but also with type 2 diabetes, most people end up with kidney trouble, but at an older age. So it is a very deadly disease to have, diabetes, because it can cause small vessel changes, leading to eye damage, premature formation of cataracts, and needing cataract surgery. And it can also lead to microvascular changes called retinopathy, for which you may need laser surgery. And as I said, it leads to kidney damage. It affects your nerves, and it can cause diabetic neuropathy. It can lead to changes in your big vessels, leading to more catastrophic effects like stroke and also heart attacks, and also lead to losing extremities, because you lose the microvasculature of the feet, leading to losing parts of your feet. So if you go back in time, in the 1800s, the average American consumed about 45 grams of sugar, the amount found in 1 can of soda every 5 days. And if you go to more recent times, it is mind-boggling to see how many cans of soda we are consuming here, amounting to nearly 765 grams of sugar, which is really mind-boggling from what we have gone to. And we started with this and we have ended up with this. So what is the best drink that you can take? Patients always ask, doctor, I don't like water, but what else can I drink? Unfortunately, water is the only safe drink that you can have. So if you look at how much sugar is in your drinks, water here has 0 grams. All the so-called sports drinks that are marketed, Gatorade, they show all these top athletes opening a bottle of Gatorade and drinking it. Is that really good for you? No, because it has nearly 21 grams of sugar. The sweetened iced tea, which is the latest craze among teenagers, it has 40 grams of sugar. How about your juices? 42 grams again. Going to your energy drinks like Red Bull, which they say, oh, I cannot wake up in the morning without a Red Bull every day, is giving you a load of 50 grams of sugar. How about your Coke? and other kinds of sodas, nearly 52 grams again. And also the coffee and iced teas, they're again giving you about 53 grams. So I would say the single safe drink for you to take is water. So I always advise patients here who are not into the habit of drinking water that they can maybe add a wedge of lemon or something to add flavor, because here they consider drinking water as a very pathetic option. So we have to kind of give them options of adding lemon wedges or something like that to improve the compliance with just water intake. So facts about sugary drinks. There are about 16 packets of sugar in a regular soft drink. And it has been shown that if you are consuming all these soft drinks, it can lead to nearly 6.75 kilograms of weight gain in 1 year. And it doesn't spare your teeth either. It can lead to a lot of teeth decay and erosion. And 47% of children are into this habit of consuming sugary beverages over water, which is a very sad state. And if you drink 600 ml of regular soft drink every day for a year, you will be drinking nearly 23 kilos of sugar. And 1.28 billion liters of carbonated drinks are bought in a year. And this is like a mind-boggling number. So we really need to quit all the sugary drinks and get back to good old water. So now going on to the screening recommendations for diabetes. There are so many patients who come to me and say when their kidney function is already down to about 30% or so, that saying that nobody ever told me that I have any kidney problem. And I am peeing normally, and I don't find any trouble using the bathroom at all. And how do you tell me, doctor, that my kidneys are affected? So unfortunately, the kidney disease can be very silent. And unlike heart attack, you don't get any kidney pain or anything. And sometimes this can be, you don't feel any symptoms till you go lower than 15% of kidney function. So the only way to catch it is by regular screening. So for type 1 diabetes, you have to, like 5 years after diagnosis, they have to be screened with some blood test and urine test, and annually thereafter. And with type 2 diabetes, they have to start screening from at the time of diagnosis and annually thereafter. So what do you check for? So you take a urine test to check for protein in your urine. This is one of the early indicators. You're not supposed to spill any protein in urine, and even like micro amounts of protein in the urine are an early indication of the diabetes affecting your kidneys. And so you need to start paying attention. And also with a blood test, which is serum creatinine that you measure, you can find out if you have kidney trouble. So everybody with diabetes and at high risk with hypertension or heart trouble, everybody should undergo a screening with a kidney function test and a urine protein level. Another important factor that we don't pay attention to is pain medications. So non-steroidal anti-inflammatory drugs called the NSAIDs. And this group involves your Motrin, ibuprofen, naproxen. All these are like now popped just like candy for minor issues like headaches or toothache or like minor body aches. And sometimes initially the doctor prescribes them for the patient, but these are not supposed to be taken after 10 days. But patients just like that it gets rid of their pain, and then they continue on it for months and sometimes even for years, because these are easily available over the counter. Most people know that this causes gastritis and peptic ulcer disease, but many people don't know that it affects your kidneys. So this group of medications can cause adverse renal events in 1 to 5% of all patients using them. This doesn't seem like a big number, but given that the large number of patients taking NSAIDs, it is estimated that about 70 million prescriptions and 30 billion over-the-counter doses annually are taken. So this translates to nearly 2.5 million patients experiencing a nephrotoxic event annually. So that is why we need to pay attention to this, because of the indiscriminate use. And sometimes for indications not even prescribed by a doctor. One patient told me that it just helps me to sleep better, so I take ibuprofen, 2 tablets every night. This is not even an indication that it's supposed to be used for. So we really need to pay attention to this. It can really affect your kidneys, even in normal individuals. But if you have kidney trouble, all the more reason that you shouldn't indiscriminately use this. And as I told you, it can be used for 10 days for pain and not more than 3 days for fever. So if you're having chronic pain issues and requiring pain medicines for more duration than this, you really need to talk to your primary care doctor to revisit this issue. So now going on to Indian traditions and the kidneys. So our Indian ancestors left us with very wonderful practices that have been shown to be useful in reducing high blood pressure, improving cholesterol profile, improving diabetes, causing mind relaxation, reducing heart disease and kidney disease. So we're going to touch upon some of these good practices. So in a broader context, yoga is one of the very important practices that our ancestors left us with. It includes theoretical and philosophical concepts called the yamas and niyamas, body techniques, which are the asanas, breathing exercise, which is the pranayamas, concentration, and meditation techniques. So we are going to go into some details about these. Among these techniques, the pranayama or the breathing exercises of varied time and pace that may be performed with or without air retention in the lungs appears to have a better risk-benefit ratio for lowering blood pressure. The main mechanism for its lowering effect on blood pressure appears to be the improvement in baroreceptor sensitivity with changes in the autonomic balance. So it decreases the sympathetic tone and increases the parasympathetic tone, which helps in reducing heart rate and blood pressure. Moreover, these pranayamas, they don't have any cost involved or specific equipment required, or for you to go to a gym, which increases its applicability. And you can just practice this every day from the comfort of your home. So this newer generation, they are running to gyms and paying exorbitant memberships, but there is something alternative which our ancestors have taught us and which is beneficial and which is very cheap, and you can do it from the comfort of your homes. So it has been proved in several studies that it has a hypotensive effect, the yoga's breathing exercises. So this large study collected about 13 articles, and 9 of which emphasized the effects of pranayamas in reducing blood pressure. And it was found that there was significant blood pressure reduction, nearly about 10 millimeter of mercury in the systolic blood pressure, and in some studies, even up to 20 points decrease in the systolic blood pressure and nearly 10-point decrease in the diastolic blood pressure. And a particular type of pranayama called the Shitali pranayama, which is a cooling pranayama best known for its calming and relaxing nature. And it is widely used in India for conditions of depression, anxiety, and hypertension. And this was shown to decrease blood pressure even in healthy volunteers, not only people with high blood pressure, but even in the normal population, it has found to reduce your heart rate and your blood pressure. So this may be a very good exercise to resort to because it reduces your systolic, your diastolic, your mean arterial pressure, and it also, by doing all this, strengthens the resting cardiovascular parameters. And this was another center that they used. This was a center-based lifestyle intervention. They made the people do yoga in a controlled setting, and then they collected some blood work to see the effects. So this was an 8-day lifestyle modification program, and yoga was at the center of this. It consisted of asanas, breathing exercises, relaxation techniques, lectures and films on philosophy of yoga and place of yoga in daily life, meditation, stress management, and then they collected some outcome measures, which included plasma glucose, your lipid profile, and all these were like fasting blood samples taken on the first day and the last day of the intervention course. And it showed tremendous improvement in the fasting plasma glucose. It reduced the total cholesterol, and the LDL or the bad cholesterol went down. The good cholesterol or the HDL went up, and the triglycerides, which were also significantly reduced. So the effects are seen in short span of just 9 days. So you can see if you practice yoga and meditation techniques over prolonged periods, how much health benefits you're going to achieve from it. The other practice that is very much practiced in India is mindfulness meditation. And this study shows that this mindfulness meditation reduces the sympathetic nerve activity, and it helps in reducing blood pressure. So in this study, the patients underwent mindfulness meditation by listening to 14 minutes of pre-recorded audio using an MP3 player, and then mindfulness techniques like breathing awareness, a mini body scan, and brief self-compassion were taught to these patients. In breathing awareness, participants were asked to notice the sensations of breathing without trying to manipulate the respiratory rate, like paying attention to taking in of air and exhaling the air. And during the body scan, participants were asked to notice sensation in different parts of their bodies. And with the self-compassion portion, participants are directed to have an open and positive attitude about themselves and asked to repeat the phrases such as, may I be loving, kind, and gentle to myself. After doing this, there was a significant reduction in systolic blood pressure, diastolic blood pressure, mean arterial pressure, heart rate, and also the sympathetic activity, which was measured by muscle sympathetic nerve activity after this intervention. So it is very important that we don't embrace blindly Western things, whereas there is so much goodness in our ancestry and our Indian culture. So I would say to get into the habit of practicing yoga, body asanas, and all these mindfulness techniques. Now, going on to another important thing, as Indians, we drink a lot of water, and we were not introduced to these sugary drinks and these fruit juices and all these energy drinks. And in fact, I learned about this culture of not drinking water only after I came to the US, which was very shocking to me. So as Indians, we always practice drinking a large jug of water in the morning and similarly also in the evening, which is a practice that we should all go back to. So the daily water intake, the best time to drink is when you first get up, also before each meal, any snack that you take, before a workout, after a workout, have water along with your medications, and drink more water to prevent illness following any exposures, and have a glass of water when you're tired. So many patients ask me how much is a good amount to follow. So the simple measure that I tell them is the 8x8 rule. So 8 glasses of 8 ounces of water, which amount to 2.5 liters a day, which is a good ballpark to be around. If you want something more specific, if you measure your weight in pounds, nearly half a pound to 1 pound of water should be, water should be consumed for your body weight. And if you want to know in kilograms, 35 ml of water for every kilogram of body weight can be consumed. But the 8x8 rule is like the easiest. So 8 glasses of 8 ounces of water is good. So this was a study exploring the daily water intake and health. So they divided patients into 2 groups, and one group consumed a lesser amount of water, and other group of subjects were made to take nearly 1 liter to 2 liters of water in addition to the control group. And all other parameters were the same, food-wise and everything. So it was shown that the systolic blood pressure was significantly decreased in the intervention group, and water supplementation also increased the body temperature, reduced the impure waste like urea, nitrogen, and it helped improve the kidney function. So some of the mechanisms by which water improved kidney function is it changes the secretion of hormones involved in blood pressure, such as renin and aldosterone. These hormones are turned off, and that helps to improve your blood pressure. And also it causes a decrease in the vascular tone, and it helps to increase the waste excretion. So if you drink and hydrate well, you're doing a host of benefit to your kidneys. So I would say to go back to drinking plenty of water and hydrating well, especially in India in the summer months, and also being a tropical country where the temperatures are high all the time. Sufficient water intake is very important. And a good indicator that you're having sufficient amount of water is that the thirst mechanism should be turned off. You should not feel thirsty all the time. And the other indicator is your urine color. So a lot of people think that urine is supposed to be yellow in color. In fact, the urine is supposed to be very, very pale yellow or almost colorless. So you have to drink enough water to maintain your urine at that level. Another practice that we as Indians follow is many of us do fasting, which are sometimes for religious reasons. And we are very in tune with fasting, which is now being adopted by a lot of Western society. Intermittent fasting has become a very huge craze of these days. And this has been practiced by our ancestors for a very long time, more on like religious grounds, or maybe they even knew the health benefits. So this was a study exploring fasting. So it consisted of a 1-year observational study in several participants who did a fasting program consisting of periods of fasting between 4 and 21 days. So there were significant reductions not only in weight, but abdominal circumference and blood pressure was also observed, and it led to a decrease in blood glucose levels almost to a low normal range, and to an increase in ketone bodies, which are bound to happen when you fast. It is converted into ketone bodies, and it is good when you enter into this ketosis. That's when it shows that the fasting is working and the metabolic switch is happening. And in fact, most of the participants said that physically and emotionally, they felt more stronger. And most of them didn't experience the hunger feeling at all. So this shows that fasting, especially intermittent fasting, is something that we can all resort to. And it has a host of benefits, as you can see. It reduces the systolic blood pressure. It reduces the diastolic blood pressure. It also reduces your blood glucose level. The hemoglobin A1C, which is an indicator of your glucose control over 3 months, that also came down. So intermittent fasting is something which is a big deal, and I advise all my patients to at least try overnight fasting for 14 to 16 hours. This can be easily done because if you have your dinner early at about 6 p.m. or 7 p.m., just by staying free till about 8 a.m. or 9 a.m., there itself you're getting about 12 to 14 hours of fasting just by having your dinner early. So I would suggest all of you to try that. Another thing is vegetarian diet. Now everybody is like switching to vegetarianism. And this was like always practiced by our ancestors for a very long time. And most Indians were vegetarian, but unfortunately we are trying to ape the West and trying to go to a non-vegetarian diet, whereas a lot of Westerners, especially the sensible ones, are adopting a vegetarian diet. So how are you helping your kidneys by taking a vegetarian diet? The glomerulus, or the filtering unit of the kidney, is very susceptible to barotrauma, and diets high in animal protein impede this filtering unit. So by taking an animal-based diet, you are affecting your kidneys there itself. And high animal protein intake diet, you don't pay attention to fruits and vegetables. So there you are increasing the acid production. And whenever you have acid, this has to be neutralized by ammonium excretion. and there you're causing more work for your kidneys. So by consuming an animal protein diet, this is supposed to be the normal blood vessels to your kidney. By consuming animal protein, this blood vessel has to be dilated so much more, and so much more filtering has to take place. And this leads to impaired autoregulation, causing to kidney damage. Also, these are the small food processes which are seen in the filtering units of your kidney. In a healthy person, it's supposed to look like this. But when you load it with all this animal protein, you see that the capillary has to dilate so much more. And these food processes, they are like so much stretched and they go so much further, causing wall tension. And this is what animal protein does to you. And also it leads to a lot of nitrogenous byproducts. The animal protein based diet like egg and hamburger and all the processed and cut meats, they all cause so much more of nitrogenous waste, causing that much more stress on your kidneys. So if possible, switch to a vegetarian diet. And as I showed you, the plate consists of plenty of fruits and vegetables and whole grains. That should be the diet that everybody should adopt and was practiced very wisely by our ancestors. Also, we know that a lot of our diet, especially South Indian diet, has a lot of turmeric in it. And now America and all the Western countries are adopting turmeric, and America has already patented this turmeric, but this came from India and our ancient traditions. It has numerous constituents, especially curcumin, and it has been shown for thousands of years and used in the treatment of various diseases because it is cheap, affordable, and a rich source of antioxidant. And if you see the benefits of the turmeric or the curcumin, it has all these host of benefits, and it has an anti-hypertensive effect, and it also causes a nephroprotective effect. It has anti-diabetic activity. It also modulates your immune system, and even to fight this COVID infection, it has been shown that turmeric and cumin-based diets, which are all our South Indian diets, are helping to fight even infections as severe as COVID. So as I said, it's helping to lower your blood sugar, lower your blood pressure, and helps in renal protection by antioxidant effect and scavenging all the free radicals. So it is in our hands to take care of our kidneys, which are working non-stop for filtering fluid and maintaining a water balance, and also removing all the toxins that we form throughout the day. So I hope this was useful to all of you and that you would take very special care of your kidneys. Thanks a lot for this wonderful opportunity. And now I can take any questions that you may have.
Yes, unmute and ask questions.
Good evening, Prabhakar. I am Dr. Chokkalingam from Chennai.
Welcome, sir.
And everyone of them joined this nice meeting. I appreciate Smrita for his excellent presentation. Very informative and is useful for everyone. I really appreciate Smrita. And I really appreciate your interest for the society, Prabhagar. So as you have been telling so nicely, you are lucky as nephrologist, Smrita, you got 2 kidneys. But as a cardiologist, we are only having only one heart, one. Oh, must be careful. But always the kidney and the heart are most interrelated. If kidney is affected, heart will be affected. If the heart is affected, kidney will be affected. Both now is a nephrocardiac syndrome or specialty is coming up. So there is reason why myself and Smrita more. That is true that Smrita and Anand Chokling are so close to each other because they want to serve for the society. I really appreciate. And I'm really thankful Prabhagar and Prasad and everyone. Only one point I would like to stress, at any moment of a time or any place of a space or time we are living, never compromise your peace of mind. And never compromise with the peace of mind your happiness. And if you are going to be happy and with the peace of mind, what our ancestors left us, what Smrita has told, all of them won't require the help of Smrita and Chokling for 100 years. If you disobey us, you have to come to us. There's no opinion or no shortcut. That's what I used to say. Please avoid hurry, worry, curry to get buried. Why you want to yourself like that? When Prabhagar, when you are now talking, how you are smiling, it makes you more younger and younger. So you are preparing yourself to celebrate your 100th birthday, Prabhagar, if you are going to have the same attitude. That is what I don't have any doubt about it. I am so happy about it. And I really appreciate Smrita, you've taken an excellent one. She was my teacher. I mean, I was, as a matter of fact, Smrita, Anand and Priya, they were all my students. Now Chokling has become their students, they have become my professors and learning from them. That is what cycle is going on. I really appreciate Smrita. And
Thanks
really
a lot, Mama, for those kind remarks.
nothing, and that too, how now Laya made a start in giving a very nice music. Your person listens music so nicely. That's what I used to say. இசையை கேட்பவர்களுக்கு இதயம் 100 வருடம் இயங்கும். அது ரொம்ப முக்கியம் நினைக்கிறேன். That what they're all in combination able to do everything. I'm so happy, ma. And this 29th is the World Art Day. You are going to celebrate. I think many platforms you can see me. I used to put you on one anecdote. Kidney heart attack before it kills you. That is the best way you can do like that. And all must join together to make our society healthy. And what you are doing, how by Zoom, how you are definitely connected so easily without any risk of COVID like that. And wherever you are, at the moment, if you think you will be connected, I really appreciate Prabhagar, Prasad, and everyone. Excellent talk, Smrita. Thank you.
Wonderful.
I think Anand is in the airport. Anand is in the airport, is now listening and giving a talk, Anand. I appreciate Anand. Yes.
Yeah, so
Very
Dr.
nice presentation. I'm glad I could join from the airport. Thanks, Dad, for joining us from India. We have a lot of friends here, and Smrita's talk was very nice. Thanks, Smrita.
Thanks a lot.
Dr. Smrita, that was a wonderful insight in the
Karthik is speaking.
nephrology and kidney disease, and also how to prevent it. Like you said, the prevalence of diabetes is ever increasing worldwide, and more so in the South Asian countries and in India. And we stand number 2 worldwide in terms of having the highest number of diabetic patients. And more so, there are a lot of people who go undiagnosed. Nearly people with pre-diabetes account to nearly 8% of the population sometimes. And also, as you said, nearly 30 to 40% of the diabetic population would end up in some form of kidney disease, and also would require treatment for the same. And also, I have one question for you. So now we get a lot of patients who say that they want to take supplements, protein supplements.
Yes.
Especially some people who go for body And some people, they feel that they need
So we encourage against all bodybuilding supplements, especially in the teenage years. They are taking lot of like whey protein and all these supplements, which are going to add like to the load of the kidneys. And not only that, they spuriously elevate the creatinine, and sometimes they come with like very alarming creatinines of like 3-4 because they're taking that much of bodybuilding supplements. So we asked them to quit all the bodybuilding supplements, and we've seen that creatinine normalizes in a lot of these people. And also in a lot of the muscular people, we are trying to measure the cystatin C more frequently, because the muscular people tend to have like higher creatinine levels, and so falsely diagnosed as having kidney disease. But if you actually check their cystatin C level, which is not that much based on muscle protein, the cystatin C is found to be in the normal range. So that is something we are tracking too. And throughout the US, there's like a big debate now to go with like cystatin C based GFR calculators, which is like the CKD epi equation more than the MDRD equation, which is like heavily driven by muscle protein. So that is a huge debate going on here. Whether it'll be like routine practice remains to be seen. But as nephrologists, we are really pushing for the cystatin C based GFR calculator rather than going by the creatinine based.
Thank you. So like what Dr. Smrita had showed us in our presentation, I think lifestyle modification and change in our food habits especially would go a long way in preventing a lot of kidney related issues. And especially in what we see in South Asian countries is we are seeing young people coming to us with type 2 diabetes, say in the early 30s or so on. And that means that the person is going to spend many years with high blood sugars. And that means he would be at risk of developing end-stage kidney disease or other complications due to diabetes. And also because the life expectancy also is increasing in India. That is one issue. And the other issues we also see, like you said, there may be malnutrition in some pockets of India where there is disparity in income and other issues. But what we also see is childhood obesity. So that's a big issue that we are facing. And we need to somehow address that. Otherwise,
obesity is like a very 50% of children are obese, which is like alarming and concerning, because all these bad habits start right from the young age. So a lot of these kids refuse to drink water. They want chocolate milk, they want fruit juices, and they want energy drinks like Gatorade. So it's very hard to get our kids to drink water because it's not considered cool. They're teased in school saying that, oh, you have just water, whereas I have Coke. So the culture is such that they are like teased when they have plain water. And so it's very alarming, the rise in, as you're saying, childhood obesity and lot of diabetes diagnosed at a very young age.
This is Dr. Shekhar Mysore. I hope I can pitch in a little bit here.
Please go ahead, sir.
Right. Dr. Smrita, it was a fantastic talk from you, especially about the positive health activity of Indians, Asian Indians for that matter. I would like you
excuse me, Dr. Smrita, I have a doubt. Can I ask? Hello.
Dr. is asking a question, he's making a point. So after that, maybe you can speak, sir.
Okay.
I would like you to put your insights into the concept of circadian rhythm and metabolic health. There have been a lot of reviews, and in ancient Indian scriptures, I cannot pronounce the Sanskrit part of it. Simply translated, it says, follow the sun. The light cycle and dark cycle. Just follow the sun. Your metabolic health will be better. and then shift over to not just vegetarian food, because vegetarian food has so many anti-nutrients in it. And the way Indians prepare their vegetarian food is better than the Americans eating their raw vegetables. These two concepts, follow the sun of circadian rhythm and metabolic health, and how to overcome the anti-nutrients in our vegetarian food, would be a very good insightful talk if you can give your opinion about this.
Cannot agree with you more, Dr. Shekhar. So yes, so the Western society and this culture of always working has led to a lot of youngsters adopting a very, very unhealthy lifestyle. So they don't have any concept of like daytime or nighttime. So work can take precedence anytime, anywhere for them. And this culture of like having the online thing and bringing work to home. At least earlier we used to go to the office, and office hours were like, may say 8 a.m. to like 5 p.m. But now these youngsters, they bring the laptop home, and even at home they start working. So they don't have any concept of like eating healthy, eating at the right time, getting appropriate amount of sleep. All this has taken a back seat. But I would say that circadian rhythm is very, very important. And there are several studies showing that following a good pattern of sleep and getting at least 8 hours of sleep every day is very important. And not only the number of hours, but the quality of your sleep, which has to be restful and not just your REM sleep. It has to go into the deep sleep. The quality of your sleep also is very important. And for you to have that good sleep quality, you need to have like good habits, like eating at the right moment. And also the body should have an indicator to turn off. So if you're working crazily on your laptop and then immediately closing your laptop and going to sleep, you cannot fall asleep because of all the excitement. So I would say like 1 hour before you plan to go to sleep, kind of like relax, calm the body, and then go to your bed when you'll have a restful sleep. And also eat healthy food, and don't resort to all these fast foods or the pre-packaged foods. Our kids don't even have time to eat these days. They just like grab all these fast foods or foods out of boxes, which are like leading to the obesity and the diabetic pandemic. So yes, Dr. Shekhar, that's a very valid point.
Thank you.
Smrita, I have a quick
Can
question.
I ask one question? Can I doubt it? Dr. Smrita?
Yes.
Hello?
Yes, uncle.
I have a doubt. Can from your
Yeah,
very
sure.
from your very excellent explanation about the health of kidneys and everything, I understand that the food habits have got a very good bearing on the general health in general and on the kidney health in particular. Now
Yes,
I want to
that's
know
correct.
the food habits of especially the in America. They store the food in refrigerator, take it out, again reheat the food, again use it, and cook for 1 week, keep it the store, again take it out whenever you need.
Kidney
Like
disease.
that.
Dr. Smrita Dorairajan.
Sorry, food habits are.
The US मधली है.
Yes, uncle, that's a very valid
Does
point.
it have any?
So
Yeah.
the refrigerated food, when you keep reusing it, the value of that food is deteriorates definitely, but it is still better than buying like food or the processed food or the canned food. So people who are extremely busy and not able to cook every day, frozen food may be an option for them, because frozen food has shown to like retain the nutrient value of the vegetables and everything. So they can use like some frozen vegetables and still try to like prepare their food from scratch. But the best would be is if you're able to prepare your food every day and from scratch and eat healthy. But if that is not an option for you, then using some frozen vegetables to prepare food is better than resorting to processed food. I hope that answers your question, Uncle.
Smrita, one question, Smrita.
Okay, thank you very much.
Smrita, what is the comment about hydration therapy? Some they say you can take excess of water, 15 liters per day, and it is good for the body. What is
So
the comment about?
there are not studies showing that much of overhydration showing any benefits. So I would say to stick to the 8/8 rule. A normal kidney should be able to excrete out whatever the water intake that you take, but I wouldn't overload the kidneys with that much of water because it can cause hyponatremia and other issues.
I also agree with you. The most important point I've been seeing is stressing water intake because 75% of our body content is the water. Because 40 trillion cells, each cell must contain 70% of the water. If we're going to dehydrate it, the cells in the body cannot function. So your stress on water intake is the must. Many may say because they don't want to have public toilet or like that, they will reluctant to take water. I think they should be avoided. So that is a must, they must take water. And as you said, most important thing, sleep is just like a meditation. And the sleep and happiness just like a butterfly. If you want to catch it, it will go away from you. If you calm down a meditation, you must come and sit. As you said correctly, if you're going to bed, you must sleep within 2 minutes, 3 minutes. Then you have a good sleep for 7 to 8 hours minimum must be. I think it's a good point you stress for the students. I have seen many people, those are saying the job tension. Job is a pressure. Please remember the tension what you feel that will produce hypertension, high blood pressure. It affects heart, brain, kidney simultaneously. So enjoy saying the thrill Deivam. That is what you must consider as the most important. In short, as what Smrita was telling, 3 mantras. Be positive in thinking, be healthy in eating, be adequate in exercising. You ought to live more than 100 years. Not that myself, Smrita, Prabhakar is telling. That is what our ancestors, thousands of years has told us, but you don't recognize or follow that, you become victim of your own diseases. I really appreciate once again, Smrita.
Amit wants to speak something.
I have a question, sir. May I?
Yeah, please.
Please go ahead.
My question is about CKD third stage, chronic kidney disease third stage due to diabetes. How dangerous is it, or what are the extra precautions one can take if one reaches?
So that's a very good question. So chronic kidney disease stage 3 is when your percentage function is less than 60%. So this stage is still remediable. So the important things that you need to pay attention to are getting your diabetes under very, very good control. So that is an important thing. And similarly, if you have high blood pressure along with your diabetes, you need to get that under very good control. ACE inhibitors or ARBs, that group of medications like lisinopril, losartan, they have shown in that stage to help with reducing the proteinuria as well as progression of CKD, and hydrating very well, and also avoiding this NSAID group of medications like ibuprofen, Motrin. This is an important thing. And when you do any CAT scans avoiding IV contrast agents. This is another important thing. But stage 3 is anywhere between 60 to when you reach below 30. So it's a wide range. But still at this stage, if you make important lifestyle changes, you can keep that same kidney function going forward and prevent or slow the progression of the CKD.
Hello, Smrita.
Thanks very much.
Hello, Smrita.
Hello, Mommy.
Mrs. Chakuli. Okay. I just wanted to, your presentation was too good. Very nice, enjoyed it. I just wanted to ask you, people do have these sugar-free sweets when they are diabetic. Is it okay?
Very, very good question. So a lot of people keep asking, I don't take sugar, but can I take the artificial sweeteners? So this artificial sweetener industry has increased several folds.
Yeah.
But the best is to avoid those two because that changes the way that your body perceives sugar. So since it has other substitutes, not sucrose, but it has other components, and these kind of change the response of your body. So they are actually very addictive and you end up using more of those. And those actually have cancer potential too. Many of them have a risk of cancer, the artificial sweeteners. So I would say it's best to train your body
Not
to
to
low sugar or sugar-free if you have diabetes.
Yeah, very nicely answered. Thank you.
Smrita, what are the fruits we can take in diabetes?
Yeah, fruits is like challenging. The banana, the jackfruit, and the mangoes, these are the highest sugar content. So still my patients sometimes like bananas. So I say it's fine to take, but not like 3 times a day or like to cut back on the number of bananas they eat. That's what I tell them. But there are other options like oranges, apples, grapefruit, guavas, pomegranate. All these are like other options that they can take.
Really good, good.
Smrita, there is one thing which I had read in WhatsApp, says about the jackfruit powder, which is used for diabetic.
Okay.
I think you can enlighten it. I just don't know much right now.
I'm not sure about that.
But I feel anything in the WhatsApp, I don't accept it. Because
No,
jackfruit or jackfruit powder must be the same content of it.
Yes.
So better you must avoid it, no doubt about it.
So anything I say is to eat as the fruit as such, rather than taking to juices or powder. I know we feel lazy because a juice is like easier to drink, but the fruit you have to like peel it and eat it. But always the fruit is much better because you know actually what is in it. Because the juice, though they claim it is fruit, there are definitely like sugar, definitely preservatives, definitely other ingredients that they're adding, which you're not going to be reading each and every label. You just pour the juice and drink it. So I would say eat it as the fruit, because the other thing they compromise on is the fiber. The fiber is there in the fruit when you eat it as the fruit. But when you take it as the juice, most of them remove the fiber or the pulp because you want that smooth texture when you're drinking. So most of these juices compromise the fiber. So eat the fruit as it is.
Just wanted to comment on the jackfruit powder. It is just not a WhatsApp viral, but it is someone in Kerala who has done this experiment and is using more like a medicine against diabetes, and he demonstrated to Prime Minister Narendra Modi too.
Yeah, exactly.
So that
So
much.
is it effective though?
That's why I think ideas from the Prime Minister would not have been there unless there is a basic proof. Somebody must have studied and then only given the audience to interview with him. So that
So is this powder a substitute for one meal, or how does that?
no. It is more like a medicine. It is a processed one, and I do not have the actual formula.
Yeah.
Okay.
But the main ingredient seems to be jackfruit, which is generally not encouraged for diabetes. But that's used
Yeah.
some processing. We do
It
not know
seems like
what.
counterintuitive, so I don't know.
That's right.
Hello, Mr. Purushotman.
Yes, sir.
Anyone may get the access to the Prime Minister or President of anyone. They must be anxious to know what it is before knowing the reality. Once you are going to say like that, then time only will say whether what they were exposed to them really good or not scientifically. There must be a basis for that. Everyone they say ghee is good, you can drink, coconut oil you can drink, we can say like that. But as a scientist, we must be knowing and careful about doing everything. Now they're saying the paleo diet is the best diet. How is going to end up with the coronary disease? Nobody knows. May be good for diabetes that they may control, but they may not control the heart attack. So listening one person stating one thing, it cannot be taken as a rule, because very important thing, because overall all the literature black and white must be like that. After some time they will know what. I'm not saying that it's not good or bad now at present. I think it needs enormous study further.
I totally
That's
agree with
what
you,
I
sir.
tell all my patients. There is no shortcut to good health. And when something sounds too good to be true, it's probably not true. So there is no shortcut. Just taking jackfruit powder is not going to cure your diabetes. So you have to be very particular and meticulous about your medicines, about your diet, about your exercise, about your sleep. Unfortunately, there is no shortcut to good health. That's what
I
I
agree with
tell
you.
all my patients.
Dr. Smrita, I think as seasoned professionals and also well trained in your specialized functions, what you say is totally, it is agreeable to all of us. We don't have any idea in that. However, so many of the findings by the doctors, by the biochemists and pharmacists, like cholesterol's role, and the even the blood pressure ratings, which are all, they went back on it. And even the early symptoms, recommendations from the WHO on COVID, they went. So several things are happening. It's not only the uneducated or people from other fields who are trying to, even the seasoned professionals, when they recommend, I think they're going back on it, and we have to keep learning as we progress. We have to accept something new which is coming up and needs to be evaluated, like you said. I totally agree.
Yes, very well said. Yes, it's all a continuum, and we are all like learning as we go along. Earlier things which were promoted as good are now like proven to be bad. So as we said, only time will say.
I just want to add some comments to what discussion has happened regarding the jackfruit powder. So now, when it comes to diabetes, when the early stages of diabetes, say person is pre-diabetic or recently diagnosed diabetes, say he has diabetes for a few months, you do anything, it will reverse, or you do anything, it will work. So even exercise will work, even your diet is going to work. So you may not need medicines. So at that particular stage, whatever you do will seem to work. But only the problem starts after a few years, say, 3 or 4 years or 5 years, when the sugars continue to go up and all your medicines, they don't work. Only then is the problem of controlling the sugars. So I don't know whether this study was done in patients who had diabetes for quite a few years, say more than 5 to 6 years, when the oral hypoglycemics actually failed to work, or was it done very early in those patients who were diagnosed to be diabetics. And also there is a very wrong conception in our minds that whatever comes from plant is safe and whatever doesn't seem to come from plant is unsafe. So that's not true. The simple medicines like metformin, what you use for diabetes, also comes from plants, and most of the medicines are all, it somehow has its origins to the plant. And one of the latest medicines in our armament for diabetes, it's called the SGLT2 inhibitors. even that originates from a bark of an apple tree. So, and even insulin is also not something that is manufactured. It is something similar to what is already available in our, all the human beings and all the other living beings. So that conception saying that, something coming from plant is safe and non-plant based is unsafe should go. That's what I wanted to tell. Thank you.
Yeah, that's a good point.
Dr. Smrita, it was excellent presentation. I am from IT industry from Bangalore. My question is related to one is the stress. I think you have very nicely articulated about that. About the food, whatever we get in the city, it's full of pesticides. We don't know what to buy, what not to buy. That's one part. Second is tender coconut seems to be good. Many people, they try that instead of going for artificial, adulterated, other kind of drinks. Maybe your opinion. Third thing is, how about milk that is coming from through our dairy? If you give some clarification, that will be great.
Yeah, so very good question. So tender coconut water is good as a supplement, but it should not take over your role of water. So water, you should drink water, and this can be in addition to water. So it has good electrolytes and water content. And since you're getting it pure, it is a good thing rather than resorting to juices and other bottled products. So as a supplement to water, tender coconut water is good. So milk, there are a lot of studies now showing that milk is inflammatory. So at least in India, earlier the cow used to come and directly we used to get the milk from the cow. So we knew exactly what was going on with the milk. But now there is like a lot of hormones pumped to the cows, and that is getting secreted in the milk. And also the milk is the pus cell count in the milk is checked. And if it is above like a certain level, the milk is certified as okay to use. And if the pus or the inflammatory cells is high in the milk, then they say it's not fit for human use. So ultimately, it's an inflammatory secretion of an animal that we are drinking. So there is a lot of theory saying that vegan, which is like excluding all milk and milk products, is the best diet that a person can be on, because it excludes this inflammation. And milk is pro-inflammatory. So if possible, a vegan diet is what, but I know it's very hard because as Indians, we eat a lot of milk and yogurt. So it's really very hard. I have found it easy to give up milk. So I don't drink milk, but I have found it very, very hard. So I still do take curd. But there are options like almond milk or soya milk or hemp milk, which are all plant-based milk that you can substitute for the cow's milk, which will be much better on your health.